Well, welcome. This is our ongoing series of getting to know our new faculty, and we're so lucky to have Dr. Katie Flynn-O'Brien with us today. Katie, welcome to the Department of Surgery, and even though you've been here for a long time. And this allows everyone who goes onto our website to get to know you a little bit. So maybe we can start with where you grew up and how medicine became your future.
Yeah, I grew up in Albuquerque, New Mexico.
Yeah, great.
And, you know, I always loved science. I was that annoying kid who really loved to know why.
Yeah.
And so really, medicine fit that. It really did. It didn't hurt that I came from a family of attorneys. And
oh, wow.
Really wasn't interested in
So no one in medicine in your family at all?
Not a single person.
Oh, wow. So they were probably a little upset that you weren't carrying a briefcase and in the boardroom and suing everyone, right?
Yeah, I was the black sheep of the family, that's for sure.
Yeah.
But they definitely appreciate it, particularly now.
Yeah. And so you then crossed the country to go to college. Yeah. So how did Brown University arise? Obviously a great school, and so many of our you probably knew you were going to be on faculty here with all the Brownies.
Yeah.
So, but how did that come about?
You know, my older brother actually wanted to go to Brown. So I probably just wanted to emulate him. He actually went to Rice University in Texas, but you know, I interviewed at Brown and with their open curriculum and really the ability to study anything you wanted. You just couldn't beat it.
Yeah.
It was amazing. And I walked onto the rowing team there, so really had a quintessential East Coast experience that I would have never. Yeah. You know,
so where did you, when you were at Brown, where did you practice with crew?
On the Seekonk.
Oh, wow.
Yeah.
Wow.
Yeah.
Yeah.
It was lovely.
Yeah, I know the area a little bit, but that's really neat. Wow. And so you then went back to New Mexico for medical school.
Yep. I took a detour through Ecuador for a year and lived in Ecuador for a year.
Wow.
And then New Mexico for medical school, and then to the other side of the country in Seattle for residency.
Yeah. And how did pediatric surgery arise?
I was lucky enough to do an elective in medical school. It was at a point when I actually still thought I would be a pediatrician. Mm. But
oh my goodness.
Was definitely in love with surgery and enthralled by surgery, and fought it for a long time. Did a lot of sub-Is in pediatrics, thinking I could convince myself to like it, but it really never worked. And pediatric surgery from then on was the goal.
And pediatric surgery, for those people who may be watching this and don't know, pediatric surgery is so competitive. It's been competitive for probably a couple decades now. I would think it's still remains so competitive. What did you do during your residency to make you competitive to match in a fellowship program?
It's a good question. Most folks who want to match in pediatric surgery really need to do that 2 years of research, at the very least 2 years of research, and be productive in those 2 years. And so I took 2 years off after my second year of residency to work with actually a pediatrician named Fred Rivara, who is really a pioneer in the pediatric injury research world.
Yeah.
And he was a phenomenal mentor. He put me in touch with a variety of pediatric surgeons in the nation, particularly focused on pediatric trauma and injury. And from there, I was able to get my MPH at the University of Washington, and be productive in the lab and in database research primarily related to pediatric injury, and meet leaders in the field. Sure.
And then you saw the light and realized Milwaukee was the place for you.
Exactly.
Yeah.
The people here when you interview all over the nation.
Yeah.
And I made a big spreadsheet saying what was, the call schedule and all the details about every fellowship program. But this place, it was the people were just amazing.
Well, that's great.
With that gut feeling that this is my home.
So great to hear. And I know that there's a little bit of a University of Washington connection here too, right? So that a number of our senior surgeons in pediatric surgery still have their heart is still, I think, at the University of Washington, and I know that we lose some of our best fourth-year medical students to the University of Washington every year. Not that it's bothered me at all in my 13 years here. Where do you think the field of pediatric surgery will be in 5 or 10 years? I ask almost everyone this question in their little area of specialty, but I know minimally invasive surgery has moved into the realm of pediatric surgery. And one of the big areas of pediatric surgery is obviously operating on little babies and all of the challenges that some unfortunate babies may have when they're born, and even bringing surgery even further into sometimes operating on babies before they're born. But where do you think we're going to be in 5 or 10 years with pediatric surgery?
It's a great question. I do think that minimally invasive approaches will continue to develop. I think the robot, for example, will ultimately get the technology to be able to work on smaller children.
Wow.
I think that we will continue to advance the field in things like ECMO and fetal surgery and really push the boundaries when it comes to creative ways to treat disease.
Yeah, one of the things that, one of the challenges that you have in your specialty that I don't have that much in mind, for example, is even though I deal with patients who are dealing with life-changing, oftentimes very sad events in surgical oncology, I don't have parents usually.
Yeah.
What little secrets have you developed? Because I know every surgeon, every pediatrician, everyone must be a little different. But what is your approach to parents who, I mean, I can only imagine the anxiety, having had a few immersion experiences with my own grandchildren.
Yeah.
What advice would you give our residents, for example, who may be watching this video?
Also a hard question. I think be open, honest, transparent. I had a couple patients in clinic yesterday, and actually of all the patients, 2 had relatively minor complications, but complications nonetheless. And both of those families made a comment about their trust in me. And I think I left that clinic sitting with that, because that's really where I find meaning in my job. Is
so exhilarating, to hear that.
I think those relationships and that trust is intense in surgery, particularly when it's with a family's child.
Yeah.
And so being open, honest, and transparent, in yourself.
Such great advice. What do you do? Last question. What do you do outside of work? Do you still row here in Milwaukee?
Well, I have a rowing machine.
Oh, okay.
So I do row in my basement. I keep quite busy with a 16-week-old golden retriever puppy and a 15-month-old daughter. So those things keep me busy, but I'm a big runner, so I have a local running group.
Oh, great. And what are the names of both the daughter and the golden retriever?
The daughter is Olive, and the golden retriever is Riley.
Oh, wow. Well, I want you to know we've had 7 golden retrievers in our lives, my wife and I, and Riley was my favorite golden retriever. So there you go.
He's lovely.
Yep. Katie Flynn-O'Brien, thank you so much for being with us today.
Thank you so much for
Thanks.